everyone, my name is Dr. Nwachukwu, and I'll be discussing sickle cell disease and genotype today. Sickle cell disease is defined as an inheritable blood disorder that is marked with defective hemoglobin. What I mean to say is that this is a group of disorders that involve when our red blood cells become misharmed and it breaks down, and due to this breakdown of the red blood cells, there is blockage. This red blood cell that's broken down and gets deformed and block tiny blood vessels in the human body, thereby preventing blood from going to supply various organs in the body and causing pain to the patient. But we want to ask, how can someone have this blood disorder? As we said, it's inheritable, meaning that one's father and mother must have it, and this child will inherit each of this gene from both parents for the person to come down with this disorder. Yes, a father may have the traits and the mother doesn't have it, then the child might end up having just the trait, but the patient will not, the child will not come down with the disorder. Such people will say that they have the traits. That means they have a tendency of passing it down to their children. And one thing we need to know is that people that have sickle cell disorder are prone to having their red blood cell die early. Normally in the human body, red blood cells all to live for about 120 days. For patients that have sickle cell disorder, their red blood cells die faster than that. So they have repeated dead red blood cells. And if the red blood cells die repeatedly, meaning that those patients will come down with shortage of blood, they become anemic, and the repeated deaths of red blood cells, not giving the body ample time to produce new blood cells, put such patients in situations that are not good and cause them to develop some symptoms, which I will talk about subsequently. There are about 3 types of sickle cell disorder. We have what we call the hemoglobin SS, hemoglobin SC, and hemoglobin S beta thalassemia. Among these 3, the most common of them is the hemoglobin SS. And so when for a child to be affected, as I said earlier, both parents must carry one copy of the sickle cell gene, which they will pass across to their children. So the parents might either be AC and the wife is AC too, so they pass it down to their child, or the father is AS and the mother is AS, and they pass. So for parents that each of them are AS couple, they have about 25% chance of passing this disorder to their children. So how do patients, children that have this disorder present? When you give birth to a child, it's a healthy young baby, but at about 3 months to 6 months of age, that's when they start showing symptoms that they have this disorder. They begin to have what we call dactylitis. What do I mean by dactylitis? These children begin to have the painful hand and foot swelling. You see them that both hands and limbs become swollen and it's painful. They have repeated visits to the hospitals, and they're always in pain, especially cold weather or hot weather. Little fatigue or stress put them into coming down with crisis. So from that particular age, those children begin to visit the hospital repeatedly for some kids, and they begin to require blood transfusion because of the repeated death of red blood cell. Because at about 3 months to 6 months, they've lost their fetal hemoglobin. They begin to develop the adult hemoglobin. The fetal hemoglobin have a coping mechanism of coping and preventing this repeated sickle cell crisis. So at about that 3 to 6 months of age, the child is prone to start having this full-blown sickle cell symptoms. So invariably, when these red blood cells block tiny vessels, they prevent blood to be transmitted to the chest, the abdomen, the joint. So this patient begin to develop a lot of symptoms. So it affects almost every system of the body. So they begin to have joint pain, which is one of the first symptoms they have. They can have abdominal pain. They can come with acute chest syndrome, where they have chest pain, difficulty in breathing. They can also have pulmonary hypertension. Some of them can also have stroke. Some of them can begin to have bone pathology, what we call osteomyelitis. Their bones begin to get weakened and dead. They can also have problem with their spleen. We call that splenic sequestration, because the blood begin to pool in the spleen. They can also have blindness, because those tiny vessels that supply the eyes, there's no blood getting to the eyes, no nutrition, nothing. So those things begin to die, those vessels begin to die, and the patient can have blindness. They can also have leg ulcers, chronic leg ulcer that will be treated repeatedly. They can also have problem with their gallbladder, where they come down with gallstones. They can also have priapism. This is where the particularly for male patient, where they have erection that is unprovoked and is not getting relaxed. So this patient, and it's painful. It's not because of a sexual desire or anything. It's because of accumulation of blood and in the penile region. They can also develop deep venous thrombosis. And for females that end up getting married and become pregnant, they can also have pregnancy complications. Some of them have difficulty in delivery. They can have repeated miscarriage. When they are pregnant, it's a lot of effort managing them, because it's a high risk pregnancy. Their life's at risk, the child is at risk. So because their body is trying to manage all of this, their body is already in a deep stress already. Then adding pregnancy to it makes it very strenuous, because the baby need blood, the mother need blood, and they are also having repeated red blood cell death. So they'll be having repeated admission in pregnancy, repeated crises, and that's really a very painful moment. If you've seen a patient that's sickle cell when they're in crisis, it's not a sight to behold. So you want to say, how do we prevent this? How do you prevent children from having sickle cell disease? It starts from primary prevention. It starts from when you're in a relationship, when you're cutting. It starts from first going to the hospital and asking the doctor, you want to run a genotype, you want to know your genotype. What do I mean by genotype? You want to do a genetic test from yourself, starting with you and I. You want to check and say, what is my genotype? We have AA, AS. So with this, you're able to know, or am I compatible with my spouse or with the one I'm intending to get married to? So there is like a genetic matching, knowing that someone that is AS or AC is not permitted or allowed to marry someone that is also AS or AC, because they have a chances of giving birth to children that are SS. But it's okay for someone who is AS to marry someone that is AA. It's okay for someone that is AC to marry someone that is AA. You get? So it's very important that we first run to the hospital, to the laboratory, and get our genetic testing to know our genotype. So stopping the vicious cycle of sickle cell disorder among children, looking how painful it is, what they are going through. You need to start with yourself. You need to educate people around you that it is important that you know your genotype today. You know your blood group, and knowing your genotype is the first step in preventing your children, your unborn kids, from coming to this world and asking themselves, why was I born? Why am I always in pain? Why is my life this stressful? Why, if I cannot have a normal life like others? I want to write exam, anything stressful, trigger crisis. So know your genotype and save the unborn kids from having this disorder. Thank you.